I'm going to be giving a report on a 27-year-old male who came in for a complete head-to-toe assessment. We started off just by doing some general survey questions. I asked him how old he was. He stated he was 27 years old. He had full level of consciousness. He was able to answer appropriately with the day and who the current president was. I also asked him about his nutritional status, which he stated that he has access to 3 full meals every day. His posture was straight. He didn't have any physical deformities that were noticeable. Whenever he walked in the room, I noticed that he had a steady gait. He stated that he doesn't use any kind of cane or walker at any time. His personal hygiene was clean and well groomed. He stated that his primary language was English and that he had had a stable mood. He was happy throughout the day. And then we moved on to check his skin and his upper extremities, which was warm and dry. His hair distribution was equal on both sides. I then moved on to his hands. I checked his skin integrity, and he didn't have any negative skin integrity. He didn't have any dehydration noted. I then moved on to check the nail beds, which were round in shape and pink. His capillary refill was less than 2 seconds in both hands. I then moved on to check his peripheral pulses at his radial and brachial, which were palpable on both sides. And then I moved on to check his scalp. He didn't have any lumps, bumps, or bruises that were felt on his scalp. He didn't have any kind of infestations or irritations on his scalp. His hair was clean and brown. I then moved on to check his temporal arteries, which were equal on both sides. I also checked cranial nerves number 5 and 7, which is his facial and his TMJ, which were both intact. I also checked his lymph nodes. All 10 were palpable and he didn't have any tenderness to any of them. I also checked his maxillary and frontal sinuses, which he didn't have any tenderness to those. I then checked his neck. He had full range of motion in his neck. I checked cranial nerve number 11, which is his spinal nerve that was intact. He had good appropriate muscle strength in his neck. I then checked his ears, which he didn't have any tenderness in his ears. The external structure of his ears didn't have any irritations or abnormalities. I then checked cranial nerve number 8, his acoustic, which was intact. I then moved on to his eyes. I checked the external structures of his eyes. He didn't have any kind of irritations on his eyelids or his eyelashes. I then checked cranial nerves numbers 2, 3, 4, and 6, his occipital, his optic, his trochlear, and his abducens, which were all intact. His sclera was white, his iris was brown, his cornea was round. I checked it from the side. He didn't have any kind of concaveness. I then checked his pupil reaction, which was equal reactive to light and accommodation. I then checked his nose. I checked his conjunctivas, which were pink as well on both sides. And then I moved on to his nose. And his nose was symmetrical to his face. His nose was patent on both nostrils. I checked on the inside of his nose for his mucosa, which was pink, and his septum was straight and symmetrical. I then checked cranial nerve number 1, which is his olfactory, which was intact. And then we moved on to his lips and his mouth. His lips were pink. He didn't have any dryness or any sores on his lips. I then looked at his teeth and his gums. His teeth were clean. He didn't have any sores on his gums or any irritations. I then looked at his buccal mucosa, which was pink, and he didn't have any kind of infections, any signs of infection. I then looked at his soft palate and his hard palate, which were appropriate to color. His tongue was clean. His tonsils were in the back of his throat. He still has his tonsils, and he didn't have any irritations to those. I then checked cranial nerves number 9, 10, and 12, which were intact. And then we moved on to his neck. His trachea was symmetrical and midline. He didn't have any visible pulsations or abnormalities to his neck. He had a full range of motion to his neck. I then checked his thyroid from the back, and it wasn't enlarged, and he didn't have any tenderness to his thyroid. I then checked his carotid artery, which was on one side at a time, so I wouldn't cut off any circulation, which it was palpable. He didn't have any thrills on either side. We then auscultated with the Bell side of the stethoscope, and no thrills or irregular pulsations were noted. We then moved on to listen to his lung sounds on his back. His posterior lung sounds, which were clear to all lung fields. He had negative CVA tenderness. His symmetrical expansion was equal to inhalation. And then he didn't have any tenderness when being palpated. His tactile fremitus for the vibrations was good. And we also listened to the front of his chest for his lung sounds, and they were clear on all lung fields. He didn't have any tenderness to his front. He didn't have any abnormal pericardial that was visible. We also palpated his cardiac sounds at his aortic, pulmonic, tricuspid, Erb's point, and mitral. He didn't have any tenderness. We then listened to those sounds sitting down with the bell and diaphragm of the stethoscope, which they were heard with no thrills or irregular pulsations. We then listened to those same sounds when he was laying down, again at the aortic, at the second intercostal space on the right, his pulmonic, second intercostal space to the left, his Erb's point, third intercostal space on the left, tricuspid, fourth intercostal space on the left, and his mitral, fifth intercostal space on the left. And we also palpated his apical pulse, which was 70. We did that lying, and then he did turn on his side to listen to the apical pulse, which again didn't have any abnormalities. We then auscultated his bowel sounds, which were present in all 4 quadrants. We did some percussion on his abdomen to feel for vibrations. He didn't have any abnormalities there. And then we did a light and deep palpation, which he's denied having any tenderness throughout that. And then we moved on to his lower extremities, where we felt for his peripheral pulses at the femoral, the popliteal, the posterior tibial, and his dorsalis pedis, which were all palpable. His hair distribution on his lower extremities was equal on both sides. His legs were symmetrical. He didn't have any edema or varicose veins noted. He had full range of motion to his lower extremities. His muscle strength was appropriate and strong. We then did a scoliosis exam, where we inspected his shoulders, his scapulas, his elbow gap, his iliac crest, and his gluteal folds, which he had a negative scoliosis test, and he also had a negative Romberg test. And that concluded our assessment.